If you're dealing with burning leg pain, tingling feet, numb toes, or that deep electric ache that keeps you awake at night, chances are someone already told you the same thing. Take B vitamins. They help nerve pain.
So you did.
Weeks passed, maybe months, and yet the pain is still there, or worse, it's getting stronger. This is the moment many people don't talk about: the frustration, the confusion, the quiet fear that something deeper is being missed. Because here's the comfortable truth: B vitamins do help neuropathy, but not always and not for everyone. And in some cases, they don't help at all. Neuropathy isn't one single condition, it's a symptom with multiple causes: blood sugar damage, circulation problems, medication side effects, autoimmune issues, vitamin absorption failures, and even nerve compression. If the root cause isn't what B vitamins can fix, your nerves won't magically heal just because you're swallowing supplements. Even more concerning, many people are taking B vitamins correctly, but their body isn't absorbing them, or they're taking the wrong form, the wrong dose, or taking them when the damage has already progressed beyond what vitamins alone can repair. And here's something few doctors explain clearly. If your neuropathy comes from diabetes, insulin resistance, poor blood flow, or long-term inflammation, B vitamins become supportive, not corrective. They may protect remaining nerves, but they won't reverse damage on their own. That's why some people feel no relief at all. It's not because the vitamins are useless, but because the problem isn't being addressed at its source. So if you've been blaming yourself, thinking you didn't try hard enough, didn't wait long enough, or didn't buy the right supplement, pause right here. This is not a personal failure. It's a missing explanation. In this video, we're going to break down why B vitamins sometimes fail, what that means for a leg and foot neuropathy, and what signs tell you that something else is driving your nerve pain. No hype, no miracle claims. Just clear, grounded understanding so you stop guessing and start protecting your nerves the right way. When people hear that B vitamins are good for nerves, it sounds simple, almost automatic. Nerve pain equals B vitamins. But neuropathy doesn't work that way, and this misunderstanding is one of the biggest reasons people feel stuck for years. Neuropathy is not a single disease. It's a final common result of many different problems damaging the nerves over time. The damage can come from blood sugar instability, reduced oxygen delivery to the nerves, autoimmune reactions, toxic exposure, medication side effects, spinal compression, or long-term inflammation. B vitamins only help in a narrow slice of those situations, mainly when the nerve damage is directly linked to a deficiency or impaired nerve metabolism that vitamins can actually correct. For example, if someone has low vitamin B12 due to poor diet, stomach acid suppression, or absorption issues, correcting that deficiency can significantly improve nerve function. But if blood sugar has been injuring nerves for years or circulation is compromised, vitamins alone cannot undo structural nerve damage. In those cases, B vitamins act more like supportive tools rather than repair mechanisms. They may help prevent further deterioration, but they don't remove the underlying stress that continues to injure the nerves every day. Another overlooked issue is absorption. Many people take B vitamins faithfully, yet their bodies never properly absorb them. Conditions like gastritis, low stomach acid, intestinal inflammation, prior stomach surgery, or long-term use of acid-reducing medications can block absorption, especially of B12. In those cases, the vitamin may pass through the body without ever reaching the nerves. This creates a false sense of treatment while the damage quietly continues. There's also the problem of form and dosage. Some forms of B vitamins require conversion in the liver or nervous system to become active. If that conversion pathway is impaired due to genetics, age, or metabolic stress, the vitamin stays inactive. Meanwhile, high-dose supplementation without guidance can sometimes cause imbalances, masking other deficiencies, or even irritating nerve tissue in sensitive individuals. Timing matters as well. Early nerve irritation may respond to nutritional support, but advanced neuropathy involves structural nerve fiber loss, impaired myelin, and altered pain signaling in the brain. At that stage, vitamins cannot regenerate complex nerve architecture on their own. Expecting them to do so leads to disappointment and delays in addressing more critical factors like glucose control, circulation, inflammation, or mechanical nerve compression. This is why two people with similar symptoms can have completely different responses to the same supplement. One improves, the other feels nothing. The difference is not effort or discipline, but the underlying driver of nerve injury. Until that driver is identified and addressed, supplements remain incomplete tools, offering partial protection at best, while the real source of nerve pain continues to operate beneath the surface, quietly worsening balance, sensation, sleep, and quality of life in ways that often go unnoticed until the damage becomes harder to reverse and the nervous system begins to adapt to pain as a constant signal rather than a warning, shifting how the brain interprets sensation and creating a cycle where discomfort persists even when the original injury is no longer obvious, which is why relying on B vitamins alone without understanding the full picture can leave people trapped in a pattern of hope and disappointment as the nerves continue to struggle under pressures that nutrition by itself was never meant to resolve or fully correct in the first place, especially when those pressures are metabolic, circulatory, or inflammatory in nature and require a broader strategy that looks beyond supplements and into how the body is actually supporting or starving the nervous system at a ear level where pain signals are generated and sustained over time without clear relief or resolution, even as treatment continues uninterrupted and expectations remain unmet while the true cause remains unaddressed and progressively entrenched in the system as the condition advances without a clear turning point in sight. One of the most confusing parts of neuropathy treatment is realizing that doing the right thing doesn't always lead to results. And this is especially true with B vitamins. Many people assume that if they are swallowing a supplement every day, the vitamin is automatically reaching their nerves. In reality, the journey from pill to nerve tissue is long, complex, and often interrupted. Absorption is the first major barrier. Vitamins, especially B12, require proper stomach acid, healthy intrinsic factor production, and a functioning intestinal lining. As people age, stomach acid naturally declines, and this is made worse by common medications like proton pump inhibitors, antacids, and acid blockers. When stomach acid is low, B12 cannot be properly released from food or supplements, meaning it never enters the bloodstream in a usable form. Even when absorption begins, transport can still fail. Chronic inflammation in the gut, conditions like IBS, celiac sensitivity, or long-term antibiotic use can damage the intestinal lining. This reduces the surface area needed for nutrient uptake, allowing vitamins to pass through without being absorbed efficiently. Many people with neuropathy also have metabolic conditions like diabetes or insulin resistance, which further interfere with how nutrients are transported and utilized at the cellular level. The vitamin may technically be in the blood, but not effectively delivered to nerve tissue where it is needed most. Form matters just as much as absorption. Some B vitamins, particularly B12 and B6, come in multiple forms. Certain forms require enzymatic conversion before they become active. If those conversion pathways are sluggish due to genetics, liver stress, aging, or chronic illness, the vitamin remains inactive. This can create lab results that look normal while nerve cells remain functionally deficient. In other cases, people unknowingly take doses that are either too low to make a difference or too high for long periods, which can paradoxically irritate nerves rather than soothe them. There is also the issue of timing and duration. Nerve tissue heals slowly and improvements happen over months, not days. But if the underlying injury is ongoing, such as unstable blood sugar or poor circulation, the vitamin is constantly trying to repair damage that keeps repeating. This leads to the feeling that nothing is working, when in fact the body is caught in a tug of war between repair and injury. Over time, the nervous system can become sensitized, amplifying pain signals even in the absence of new damage, making simple nutritional support feel completely ineffective. This is why relying on B vitamins alone, without addressing absorption, form, dosage, and ongoing nerve stress, often leads to stalled progress and growing frustration as symptoms persist and confidence in treatment quietly erodes despite consistent effort and good intentions. Another critical reason B vitamins fail to relieve neuropathy pain is because the nerves are not just damaged, they are being continuously stressed by conditions that vitamins cannot correct on their own. Nerve tissue is extremely sensitive to oxygen supply, blood flow, and metabolic stability. When circulation is reduced even slightly, nerves in the legs and feet are often the first to suffer because they are farthest from the heart. Conditions like vascular stiffness, thickened blood, smoking history, dehydration, or sedentary lifestyle can quietly limit nutrient and oxygen delivery to the nerves. In this environment, adding vitamins is like delivering building materials to a construction site with no road access. The resources exist, but they cannot reach the area where repair is needed. Blood sugar instability is another major driver. Even in people who are not formally diagnosed with diabetes, frequent spikes and crashes in glucose can inflame and injure nerve fiber. Elevated glucose alters nerve signaling, damages the protective myelin sheath, and disrupts mitochondrial energy production inside nerve cells. B vitamins cannot stabilize glucose levels or prevent the oxidative stress caused by repeated sugar fluctuation. As long as this metabolic stress continues, nerve damage outpaces repair, and pain signals persist regardless of supplementation. Inflammation adds another layer. Chronic low-grade inflammation, often driven by poor sleep, stress hormones, excess visceral fat, autoimmune activity, or unresolved infections, sensitizes nerve endings and lowers pain threshold. Inflammatory chemicals amplify nerve firing, making mild signals feel severe. While some B vitamins support nerve metabolism, they do not suppress systemic inflammation in a meaningful way. This is why neuropathy pain can feel worse at night or during periods of stress, even when vitamin intake is consistent. Mechanical factors are also frequently overlooked. Spinal disc degeneration, posture-related compression, tight hip muscles, or scar tissue from past injuries can irritate nerve roots long before symptoms appear in the legs or feet. In these cases, the nerve is being physically compressed or stretched, creating pain that no supplement can resolve. The nerve remains under tension, sending distress signals that are misinterpreted as nutritional deficiency. When these drivers operate together, the nervous system adapts by becoming hyper-alert. Pain pathways strengthen, and the brain begins to expect pain, reinforcing the signal even when external damage slows. This central sensitization explains why neuropathy can persist despite normal lab values and proper supplementation. Until circulation, metabolic stress, inflammation, and mechanical pressure are addressed alongside nutritional support, B vitamins remain supportive but insufficient, unable to overcome the continuous strain placed on vulnerable nerve tissue that is fighting multiple battles at once without relief or meaningful recovery. A final reason B vitamins often fail to bring relief is because neuropathy pain is not only a problem of damaged nerves, but also of how the brain and spinal cord learn to interpret pain over time. When nerve signals fire repeatedly for months or years, the nervous system adapts, pain pathways become reinforced, thresholds drop, and the brain starts treating discomfort as a constant background signal rather than a warning. This process is known as pain sensitization, and once it develops, fixing the original trigger alone is often not enough to stop the pain experience. In this state, even minor nerve input can feel intense. Light touch, temperature changes, or pressure from shoes or bedding may trigger burning or stabbing sensations. At this stage, the pain is no longer proportional to the amount of physical nerve damage. The nervous system has essentially turned the volume knob up. B vitamins cannot reset this process because they work at the level of nerve metabolism, not pain signal interpretation. They may nourish nerve cells, but they do not retrain how the brain processes incoming signals. Sleep disruption plays a major role here. Poor sleep increases pain sensitivity by altering neurotransmitters involved in pain control. Many people with neuropathy struggle with fragmented or shallow sleep due to nighttime pain, which then worsens nerve sensitivity the next day. This creates a loop where pain disrupts sleep and sleep loss intensifies pain. B vitamins do not correct this cycle, and without addressing sleep quality, nerve pain often remains resistant to improvement. Stress further amplifies the problem. Chronic stress hormones increase inflammation and reduce pain tolerance. They also interfere with nerve repair by diverting resources away from healing and towards survival responses. People under constant stress may notice neuropathy flare-ups during emotionally demanding periods, even when their supplement routine remains unchanged. This reinforces the belief that nothing is working, when in reality, the nervous system is being pushed into a heightened alert state that vitamins cannot calm. Over time, the brain builds expectations around pain. It anticipates discomfort and reacts faster and stronger, even when the original nerve injury has stabilized. This is why some people continue to experience neuropathy symptoms despite improved blood work, better nutrition, or stabilized medical conditions. Without addressing pain sensitization, sleep disruption, stress load, and nervous system regulation, B vitamins are left trying to support nerves inside a system that is already primed for pain. making meaningful relief difficult and inconsistent, while symptoms linger in a pattern that feels stubborn, confusing, and emotionally exhausting for those who are doing everything they believe they are supposed to do, but still wake up each day with the same burning, tingling, or aching sensations in their legs and feet that refuse to fade. The last piece many people never hear about neuropathy is that improvement often requires a layered approach rather than a single solution. And this is where expectations around B vitamins quietly fall apart. Supplements are often treated as cures instead of tools, and when they are used in isolation, they are asked to do a job they were never designed to handle alone. Nerve health depends on a balance between protection, repair, and the removal of ongoing damage. B vitamins mainly support nerve metabolism and maintenance, but they do not correct circulation problems, stabilize blood sugar, reduce chronic inflammation, improve sleep architecture, or reverse mechanical nerve stress. Without addressing these areas, nerve repair remains incomplete. Neuropathy tends to progress slowly, which makes it deceptive. Symptoms may feel stable for long periods while subtle damage continues underneath. This leads many people to delay broader intervention, assuming that supplements will eventually kick in. Meanwhile, nerve signaling becomes more disorganized, balance worsens, and pain patterns become ingrained. By the time frustration sets in, the nervous system has already adapted to dysfunction, making recovery more complex and slower than expected. Another challenge is that nerve healing is energy intensive. Nerve cells require adequate oxygen, glucose stability, and mitochondrial function to repair themselves. If fatigue, anemia, thyroid dysfunction, or chronic illness is present, the body may not have the resources needed to support regeneration. In this context, vitamins alone cannot overcome systemic deficit. They become supportive inputs rather than drivers of recovery, helping only marginally while deeper imbalances continue to drain the system. There is also the issue of consistency across the body. Neuropathy rarely exists in isolation. It often coexists with muscle weakness, joint stiffness, poor posture, reduced mobility, and fear of movement due to pain. Reduced movement further decreases circulation, reinforcing nerve stress in the legs and feet. Without addressing movement patterns and physical conditioning, nerves remain trapped in an environment that limits healing, regardless of supplementation. When people finally adopt a more comprehensive strategy addressing blood flow, metabolic health, inflammation, sleep, stress regulation, and mechanical factors alongside targeted nutritional support, progress often becomes noticeable, even if slow. Pain intensity may decrease, flares become less frequent, and function gradually improves. This is when B vitamins start to make sense, not as miracle fixes, but as part of a coordinated effort to create conditions where nerves are no longer under constant attack. Without that broader framework, relying on supplements alone often leads to stalled improvement, ongoing discomfort, and the mistaken belief that the body has somehow failed to respond, when in reality it was never given the full support it needed to move out of a chronic state of nerve distress and toward meaningful stabilization and gradual recovery over time. If you've been dealing with leg or foot neuropathy and wondering why B vitamins haven't brought the relief you hoped for, the most important thing to understand is this: your body is not broken and you didn't do anything wrong. Nerve pain is complex and it rarely has a single cause or a single fix. Supplements can play a role, but real improvement usually comes from understanding what is still stressing your nerves and slowly removing those pressures one by one. When circulation improves, blood sugar stabilizes, inflammation calms, sleep deepens, and the nervous system feels safer, the body finally gets a chance to repair rather than just survive. Progress may be gradual, but it is possible. And once you stop chasing quick fixes and start working with your nervous system instead of against it, neuropathy stops feeling like a mystery and starts becoming something you can manage with clarity, patience, and control.